everyone. I want to say that dealing with health issues is not something that anyone enjoys doing, especially when it comes to our kidneys. In order to protect these essential organs, it is absolutely necessary to take immediate action. The glomerular filtration rate is a measurement that may be used to determine whether or not kidney function is declining. The video that you are about to see will introduce you to 6 simple morning routines that can help prevent and even reverse this decline. The GFR. These straightforward adjustments to your daily routine have the potential to have a major influence on any stage of chronic kidney disease, CKD, thereby assisting you in avoiding the need for dialysis and improving the health of your kidneys. Stay here with us to learn about these practices that will completely change your life and get you started on the path to greater health. Disease of the kidneys, commonly referred to as renal disease, is a condition that arises when the kidneys get damaged and are unable to effectively clean the blood. In addition to regulating blood pressure and ensuring that electrolyte levels remain in a state of equilibrium, the kidneys are responsible for eliminating excess fluid and waste products from the bloodstream. It is possible for waste and fluids to collect in the body when kidney function is impaired, which can lead to a variety of health problems. Around the world, chronic kidney disease is a significant public health concern. According to the Global Burden of Disease study, chronic kidney disease affects around 800 million people worldwide, which is equivalent to approximately 10% of the population. The fact that kidney illness is so prevalent makes it one of the most common chronic conditions found all across the world. If chronic kidney disease, CKD, develops into end-stage renal disease, ESRD, the kidneys will stop functioning entirely, and the individual will require either dialysis or a kidney transplant in order to survive. In addition, end-stage renal disease, ESRD, significantly raises the risk of cardiovascular illnesses, which are the leading cause of death among patients who have chronic kidney disease, CKD. Certain illnesses, such as diabetes and high blood pressure, frequently serve as the initial triggers for kidney disease. Diabetes can result in a condition known as diabetic nephropathy, which is characterized by the damage that high sugar levels cause to the filtering units of the kidneys. High blood pressure can cause damage to the blood arteries in the kidneys, which can make it difficult for the kidneys to function properly. Other factors that might lead to kidney disease include recurrent kidney infections, glomerular nephritis, which is an inflammation of the kidneys, polycystic kidney disease, and obstructions in the urinary tract that remain for an extended period of time. The symptoms of renal illness can be quite severe and can manifest in a variety of regions of the body. Patients with chronic kidney disease, CKD, may not exhibit any symptoms in the early stages of the disease, which is why it is frequently referred to as a silent disease. On the other hand, when the condition worsens, symptoms may include swelling in the legs, ankles, and feet as a result of fluid retention, feeling fatigued and weak as a result of toxins building up in the blood, having difficulty concentrating and thinking clearly, having high blood pressure that is difficult to manage, nausea, vomiting, and lack of appetite. The presence of fluid in the lungs causes difficulty breathing. Toxins in the body are the cause of the persistent itching. A patient named John, who suffers from kidney disease, divulged his story. For some reason, I never considered that my fatigue and edema were symptoms of kidney failure. After I had finally come to terms with everything, it was almost too late. In addition, kidney illness causes a significant financial burden on patients as well as on healthcare systems. The treatment of chronic kidney disease, CKD, and end-stage renal disease, ESRD, is costly due to the necessity of dialysis drugs and possibly a kidney transplant over the course of treatment. In the United States, Medicare spends around $120 billion annually on treatments for chronic kidney disease and end-stage renal disease, ESRD, which accounts for more than 20% of the total spending on Medicare. As a result of frequent trips to the doctor, weariness, and other health problems, people who have chronic kidney disease sometimes have difficulty maintaining their employment. In addition to lowering one's quality of life, this can result in financial difficulties. Patients may experience feelings of loneliness, anxiety, and sadness as a result of the disease, which can have a negative impact on their mental health and relationships. At this point, let's investigate which morning routines have the potential to make a big difference in the management of renal disease. Let's get our morning routine started off well by having a delicious breakfast, one that provides the kidneys, which are the primary filters in our bodies, with the nourishment they need. Certainly, there are particular meals that have the potential to significantly impact kidney health by increasing the flow of nutrients from your arteries to your kidneys. Beets are a fantastic option to consider. In addition, they contain a high concentration of nitrates, which your body converts into nitric oxide. Through its ability to relax your blood vessels, this chemical increases the amount of blood that flows to a variety of organs and tissues. Beets, when consumed on a regular basis, have the potential to boost glomerular filtration rate. Additionally, GFR blueberries and strawberries are of the highest quality. They are flavonoids which not only assist widen arteries but also minimize plaque development and promote nutrient delivery in the capillaries, are exactly what is required for good kidney function. Flavonoids are found in vegetables. There are tomatoes, are actually highly beneficial, despite the fact that they are classified as meals that should be avoided on numerous websites. These substances have the ability to reduce the activity of the angiotensin-converting enzyme, ASA, which is generally responsible for the constriction of blood vessels. In this way, arterial flow is improved, and the pressure that is placed on your kidneys is reduced. According to research, tomato extract has the ability to suppress ACE, which in turn reduces inflammation and prevents blood clots from forming, because of the significant amount of omega-3 fatty acids that walnuts contain. Those nuts are extremely beneficial to your kidneys. These lipids, in conjunction with other nutrients such as vitamin E and L-arginine, stimulate the generation of nitric oxide throughout the body. In addition to lowering blood pressure, this also brings about a reduction in inflammation. By include a small amount of walnuts in your breakfast, you can get the benefits of these health benefits. It is possible that drinking coffee first thing in the morning can actually be beneficial to your health, provided that you do it in moderation. There is a correlation between drinking approximately 2 to 3 cups of coffee on a daily basis and a reduced likelihood of getting chronic kidney disease, according to research evidence. Coffee with chronic kidney disease, CKD, contains a wealth of bioactive chemicals, including caffeine, chlorogenic acid, acids, and diterpenes, all of which are beneficial to one's health. Antioxidants found in coffee, particularly polyphenols, have the ability to reduce inflammation and oxidative stress, both of which are known to contribute to kidney damage. Chronic inflammation and oxidative stress are known to accelerate the progression of chronic kidney disease, CKD, and the antioxidants found in coffee can help counteract these effects. Additionally, caffeine has a diuretic effect, which means that it helps to flush out toxins from the kidneys. This could potentially reduce the chance of kidney stones and other illnesses that are related to the kidneys. One of the most significant risk factors for chronic kidney disease is diabetes type 2. The chemicals included in coffee have the potential to improve insulin sensitivity and glucose metabolism, which ultimately results in better regulation of blood sugar levels. This can reduce the likelihood of developing diabetic nephropathy, which is a common consequence of diabetes that results in damage to the kidneys. Furthermore, despite the fact that high blood pressure is another substantial risk factor for renal disease, it has been demonstrated that drinking coffee in moderation has a favorable effect on the regulation of blood pressure. Coffee contains polyphenols and potassium, both of which help relax blood vessels. This, in turn, improves blood flow and lowers hypertension, which in turn protects the kidneys from the damage that is caused by high blood pressure. It is possible to increase the benefits of your morning coffee by combining it with physical exercise because of the synergistic effect. Exercising first thing in the morning is not only a fantastic way to begin your day, but it also provides a number of health benefits, particularly with regard to the health of your kidneys. Being physically active on a consistent basis is necessary for sustaining cardiovascular health, which in turn helps to promote renal function. Exercise lowers the risk of conditions such as hypertension, high cholesterol, and obesity. It also increases blood circulation, which is essential for the kidneys to perform their function of blood filtration effectively, and it helps avoid damage to the blood vessels of the kidneys. People who have type 2 diabetes might benefit tremendously from physical activity when it comes to controlling their blood sugar levels. It does this by increasing insulin sensitivity and assisting muscle cells in more effectively absorbing glucose, which in turn helps to lower blood sugar levels and aids in the prevention of the advancement of diabetic nephropathy. The combination of regular exercise and the blood sugar regulating characteristics of coffee has the potential to greatly reduce the risk of chronic kidney disease, CKD. Due to the fact that obesity is a substantial risk factor for chronic kidney disease, CKD, it is also essential for kidney health to maintain a healthy weight. Through the stimulation of your metabolic rate and the promotion of calorie burning, early workouts can assist you in managing your weight control. Activities as seemingly little as walking, running, or yoga can have a significant impact on one's health. Participating in regular physical activity helps to protect the kidneys from damage caused by obesity and enhances renal function and function overall. 7. Intermittent fasting. Intermittent fasting, often known as IF, is an effective method for improving metabolic health and bolstering kidney function. A significant amount of weight loss and an increase in insulin sensitivity have been demonstrated to be achieved by the utilization of this dietary approach, which consists of alternating periods of eating and fasting. Both of these are essential in the management of chronic kidney disease, CKD, and evidence suggests that intermittent fasting may even be of assistance. This is accomplished by enhancing the body's responsiveness to insulin and reducing the amount of sugar in the blood. Persons are able to reverse type 2 diabetes. This is quite necessary in order to steer clear of diabetic nephropathy, which is a significant complication of kidney illness. In addition to that, it is beneficial for controlling blood sugar levels and managing weight. A reduction in inflammation and oxidative stress, both of which are essential in slowing down the progression of chronic kidney disease, CKD, can be achieved with intermittent fasting. Autophagy, the natural process by which the body eliminates damaged cells, is facilitated by intermittent fasting, which in turn helps reduce inflammation and oxidative damage in the kidneys. This dietary approach has a number of benefits, one of which is improved cardiovascular health. Intermittent fasting helps reduce blood pressure, cholesterol, and triglycerides, all of which contribute to improved kidney function. The benefits of intermittent fasting go beyond simply skipping meals, as the health of the cardiovascular system and the kidneys are strongly related to one another. The 16-8 approach, in which you eat within an 8-hour window and then fast for 16 hours, is one of the most common methods of intermittent fasting. Another method is the 5.2 diet, which is eating normally for 5 days and then restricting calories for 2 days that are not consecutive. The adaptability of these designs allows them to fit a variety of lifestyle requirements. During periods of fasting, many people report experiencing enhanced mental clarity and attention, as well as improved self-discipline and healthier eating habits. This is in addition to the physical benefits that are associated with fasting. For those who are contemplating the practice of intermittent fasting, it is essential to select a strategy that aligns with their individual health objectives and to get the advice of a qualified medical expert, particularly if they are coping with pre-existing health concerns. While you are working toward improving your glomerular filtration rate, GFR, a personal notebook can be one of the most helpful things you utilize. Here is something that will help everyone who is journaling. When combined with the other sound practices that were discussed in today's video, because it enables you to see your destination more clearly, it has the potential to produce remarkable outcomes. An illustration of this would be the remarkable impact that physical activity has on bringing down one's blood pressure. And it is equally as crucial to be aware of the precise degree to which you are progressing. You are also able to monitor other levels, such as glucose, the amount of food you consume, your weight, and other things. When it comes to determining what works best for you, this is a wonderful method. Consider establishing a morning ritual as a means of bringing all of this together. There are some people who choose not to have morning routines. On the other hand, this does not mean that you cannot make one that is tailored to your current way of life. In order to accomplish this, you will need to set aside 1 hour each morning. Consider which of the helpful routines presented in today's video will be most beneficial to you, and then be sure to include those routines into your morning routine. Things like your ideal meal, your morning workout, and your journaling could fall into this category. These activities, when combined, have the potential to make the hour of your morning the most productive. Always keep in mind that the positive habits you develop will have a snowball effect on your overall health. You will see a beneficial impact on other elements of your life that you would like to alter once you begin performing one small thing that demands willpower with the intention of changing it. Personal self-control is analogous to a muscle. When you use it more frequently, it becomes more powerful, which in turn gives you more willpower to utilize for other things. By committing to this morning routine, you will be able to establish a positive tone for the remainder of your day. You will discover that you are more energized, focused, and driven to keep these healthy behaviors, which will ultimately lead to improved kidney function and general health. As a result, begin your journey toward better health now by establishing the straightforward yet effective morning routines. However, blueberries are yet another food that possesses remarkable qualities. Strawberries and blueberries both include flavonoids in their composition. The presence of these potent substances helps to widen the arteries, which in turn reduces the accumulation of plaque and boosts the passage of nutrients through the capillaries. Our ideal breakfast is designed to accomplish precisely this, and we hope to accomplish it. In addition, tomatoes are present. On numerous websites, tomatoes are frequently described as a meal that should be avoided or consumed in moderation, yet they truly provide a number of remarkable advantages. The angiotensin-converting enzyme ACE, which is responsible for the constriction of blood vessels and the subsequent elevation in blood pressure, can be inhibited by the consumption of tomatoes. It's possible that you're familiar with ACE inhibitors, which are employed in the medical field. They function in a similar manner by inhibiting the action of this enzyme, which in turn opens up your blood vessels and enhances the flow of blood through your arteries. It has been demonstrated through research that tomato extract has the ability to inhibit ACE, reduce inflammation, and disrupt platelet aggregation, which is wonderful for improving circulation across the body. In addition, walnuts are a good diet for maintaining healthy kidneys. Due to the high levels of omega-3 fatty acids that walnuts contain, they are very healthy for your kidneys. Walnuts, in point of fact, are among the most beneficial plant-based sources of omega-3 fatty acids. In addition to this, they are loaded with minerals such as vitamin E and L-arginine, both of which encourage the creation of nitric oxide in your body. Nuts are beneficial for lowering blood pressure and reducing inflammation because of this reason. To attain the desired results, it is not necessary to consume more than a few nuts for breakfast each day. Just be sure you don't consume too much of them. By incorporating these meals into your morning routine, you can significantly improve the health of your kidneys as well as your general well-being. For the purpose of providing nourishment to your kidneys and providing support for the critical functions of your body, you should begin your day with a breakfast that consists of beets, blueberries, strawberries, tomatoes, and walnuts. When it comes to supplements, there is a beneficial routine that can be initiated with the simple act of taking a single tablet prior to breakfast. Even though this is more of a supplement, the effects of this supplement, when paired with the healthy behaviors that we have been discussing, can bring wonderful advantages. The topic of discussion is berberine. Berberine is something that we usually recommend for those who have type 2 diabetes, also known as T2D, but it can be of great benefit to anyone who has metabolic issues. One of the primary explanations is that berberine is of great assistance to individuals who are attempting to reduce their body fat percentage. With regard to this particular aspect, we believe that it is one of the very few supplements, and it may perhaps be the only one, that actually performs as stated. The findings of a study of 12 research verified this, demonstrating that test subjects who took berberine saw a considerable reduction in their body weight. Researchers believe that the reason berberine is so effective is that it prevents the growth of adipose cells, which are fat cells, at the molecular level. Berberine is frequently combined with other supplements in order to increase its qualities. An individual who is interested in enhancing their levels of HbA1c and combating T2D may find that combining berberine with banaba leaf extract is an effective combination. When it comes to weight loss, it is well recognized that this combination is more effective than berberine by itself. This nutraceutical formulation has also been shown in a number of trials to be capable of entirely normalizing glycemic levels in those who have T to D. Keeping your weight at a healthy level is directly related to reducing the amount of stress that your kidneys are under, which is why this is incredibly beneficial for your GFR. It is our recommendation that you educate yourself about this remarkable supplement if you are interested in giving it a try. The addition of berberine to your morning routine has the potential to significantly improve the health of your kidneys as well as your general well-being. It is a straightforward step that, when paired with a nutritious breakfast, consistent physical activity, and the practice of journaling, can assist you in achieving improved health outcomes. 3 of the best habits to have. Be sure to watch your cholesterol levels. In order to safeguard your kidneys, which are the most valuable filters in your body, it is essential to manage your cholesterol levels on a daily basis. Your total cholesterol should be kept below 200 milligrams per deciliter, or mgdl, and your LDL bad cholesterol should be kept below 100 milligrams, or DL, in order to increase your glomerular filtration rate, GFR, as stated by scientific research. A high cholesterol level is not only one of the primary causes of atherosclerosis, which is a condition in which your organs gradually stop functioning, but it also causes continuous damage to the glomeruli, which are the filtering units in your kidney glands. It is crucial to keep your cholesterol levels under control if you want to improve your GFR, and the healthy behaviors that you will learn from watching this video will assist you in managing your cholesterol levels. By taking a supplement known as red yeast rice, which is also known as RYR, what is red yeast rice, you may manage it in the most natural way possible. This supplement was first introduced in Asia and has since gained popularity all over the world. There are a lot of people who take RYR as an alternative to taking statins. This is due to the fact that statins like Mevacor or Lipitor are helpful against high LDL, but they also come with a number of undesirable side effects. In contrast, our YR has the potential to lower LDL levels by 26% in just 8 weeks, and it does so without the adverse effects that are typically associated with statins. Statins are often the only medications that are capable of achieving the effect of decreasing LDL by 26%, which is why RYR are an exceptional option. Not only that, but RYR is one of the few supplements that has been investigated for its capacity to heal damage within the glomeruli and nephrons, which is a significant accomplishment. There have been a great number of studies that have demonstrated its effectiveness, to the point that pharmaceutical companies have licensed an application. A variety of chemicals derived from this supplement allowed it to become one of the most widely used drugs in the world today. It is therefore possible that introducing red yeast rice into your daily routine, in addition to the other healthy behaviors that are discussed in this video, can be of great assistance in the management of your cholesterol levels and the improvement of your kidney health. Our second prescription for today is a supplement that has had exceptional effects in a number of studies involving approximately 1,000 people who are in stages 3, 4, and 5 of chronic renal failure, CRF. This supplement, which is known as Cortese-SAPS, has drastically reduced the levels of creatinine in the participants. Incorporating cortisol EPS into your morning routine is something that you should absolutely do, since it is quite remarkable. People who were diagnosed with stage 4 chronic renal failure were able to reduce their creatinine levels by an astounding 18.3% in just 3 months by taking quarter steps, according to a big study. It is essential for the health of the kidneys to reduce the levels of creatinine, as elevated creatinine levels are an indication that the kidneys are not functioning their normal functions. By lowering these levels, Cortese EPS is able to assist the kidneys in performing their functions more efficiently, which is essential for better health and well-being overall. However, what many people do not realize about Cortese EPS is that its primary advantage is not simply lowering creatinine levels. Cortese EPS is quite effective when it comes to halting proteinuria, which is a condition in which an abnormal amount of protein is present in the urine, which indicates that the kidneys have been damaged. A reduction in this protein leakage is achieved with the use of quarter steps, which in turn protects the kidneys from additional injury. On account of this, it is a wonderful supplement for anyone who is interested in supporting the health of their kidneys. In addition to the fact that you can take quarter steps in a variety of different ways, you can also take the extract, which is easily accessible in the form of capsules or powder. This method is not only practical, but it also guarantees that you will receive the same dosage on a daily basis. Additionally, you can produce tea by utilizing the fruiting bodies of quarter steps as an alternative. This time-honored technique is popular because of the earthy flavor it imparts, and it may be a calming way to begin your day. Besides the positive effects it has on kidney health, quarter SEPs also possesses other qualities that are beneficial to one's health. Boosting the immune system, increasing energy levels, and improving exercise performance are all established benefits of this substance. Additionally, cortisol possesses anti-inflammatory and antioxidant properties, both of which can assist in protecting the body from a variety of adverse health problems and diseases. When you decide to incorporate quarter steps into your regimen, it is absolutely necessary to select a product of superior quality. Keep an eye out for dietary supplements that have been proven to be free of any toxins. In the event that you feel more comfortable preparing tea, it is vital that you use genuine quarter steps fruiting bodies rather than substitutes. In conclusion, Cordis EPS is a potent supplement that has the potential to provide considerable advantages on renal health by reducing levels of creatinine and preventing the production of proteinuria. The fact that it also has positive effects on your health makes it an excellent complement to your regular regimen. It is possible to boost kidney function and overall health by incorporating quarter steps into your morning routine. This can be accomplished by using either the extract or the tea preparation. The most effective morning routine you can begin is to consume garlic on an empty stomach. Garlic is a powerful medicinal agent. Because of this practice, it has been demonstrated that blood sugar levels can be lowered, insulin sensitivity can be improved, and blood pressure can be lowered by as much as 9.5 millimeters of mercury. Additionally, it has the ability to combat high cholesterol levels, making it an excellent addition to your regimen, particularly for individuals who are suffering from chronic renal failure. Garlic that contains CRF has been shown to provide remarkable benefits for persons who have CRF, and these benefits are supported by scientific research. The use of hypertension medicine, which is essential for bringing down creatinine levels, can be reduced or even eliminated with the help of this intervention. As an additional benefit, it assists in the management of sugar levels, cholesterol, and inflammation. Garlic must be prepared in a particular manner in order to acquire the maximum number of benefits. However, the clove itself does not contain the active ingredient that is found in garlic allicin. The only time it can be produced is after the clove has been sliced or crushed and then allowed to sit for a minimum of 10 minutes. Allicin is the component that is responsible for the potent therapeutic benefits of garlic. The anti-inflammatory, antioxidant, and antimicrobial properties of this substance are significant. Additionally, olive oil and parsley can be added to the mixture in order to enhance the absorption of allicin and reduce the odor. Olive oil has beneficial lipids that assist your body in absorbing the lice and doing so more effectively, while parsley has the ability to reduce the pungent odor that garlic may have, is able to become more pleasurable to ingest. Garlic, in addition to being a superfood, includes a number of other useful components, including sulfur, selenium, and a variety of vitamins and minerals with health benefits. Each of these substances contributes to the general health and well-being of your body by working together. Garlic contains sulfur compounds that can assist in the detoxification process by boosting the performance of enzymes that break down pollutants in the body. In addition to assisting in the prevention of cell damage, selenium is a vital element that helps to strengthen your immune system. Garlic consumption on a regular basis has been demonstrated to be associated with considerable improvements in a variety of health indices, according to studies. One study, for instance, discovered that taking garlic supplements resulted in a reduction in blood pressure in those who were diagnosed with hypertension by an average of 8 to 3 million VH cores. In yet another study, garlic was found to have the ability to reduce total and LDL cholesterol levels by 10 to 15%. Additionally, it has been discovered that garlic can enhance the flexibility of blood vessels, which is an essential factor in ensuring that blood flow is maintained in a healthy manner and lowering the risk of cardiovascular disorders. The increased blood flow to your kidneys results in a more efficient transport of oxygen and nutrients, which in turn helps to protect and improve the function of your kidneys. It is recommended that you include garlic in your morning routine. To prepare, just chop or crush 1 clove of garlic. You should wait 10 minutes before swallowing it, and then you should do it with a glass of water. Additional advantages can be obtained by combining the smashed garlic with a tablespoon of olive oil and a pinch of chopped parsley. This alternative is also available. You may take advantage of garlic's myriad health advantages and take a proactive step toward improving your kidney health and general well-being if you incorporate garlic into your daily routine with the intention of enhancing your overall well-being. Begin each day with this strong habit, and you will be able to witness the good changes that it has the potential to bring forth in your life. By introducing garlic into your regimen first thing in the morning, not only do you improve your kidney health by taking preventative measures, but you also improve your entire health and well-being while doing so. Imagine being able to increase your energy levels, boost your blood flow, and fortify your immune system each and every morning. It is all because of this straightforward yet efficient routine. The benefits are not limited to your kidneys. You will also be able to support the health of your heart, manage your cholesterol levels, and enhance the natural detoxification processes that occur within your body. There is a good chance that you will observe a domino effect on other elements of your health as you incorporate garlic into your daily routine. A life that is more balanced and full of vitality can be achieved through the regulation of blood sugar levels and blood pressure in a more effective manner. If you are aware that such a minor adjustment can have a major effect, you will experience a greater sense of empowerment. Always keep in mind that consistency is essential. With consistent effort and practice, you will be able to bring about the beneficial changes you are looking for. You should combine this practice with other helpful routines that are discussed in this video, including as eating a nutritious breakfast, engaging in regular physical activity, keeping a journal, and taking beneficial supplements such as cord, SEPs, and red yeast rice, all at once. The combination of these routines constitutes an all-encompassing strategy for preserving and enhancing your kidney function as well as your general health. I am grateful that you remained with us to the very end. Being committed to learning and putting these habits into practice is an essential step in becoming a healthy version of yourself. We sincerely hope that you find this material to be motivational and helpful. Don't forget to give this video a thumbs up if you found it entertaining, and subscribe to our channel for other content that is both informative and focused on health. Through the process of subscribing, this will ensure that you are always up to date on the most recent advice and methods that can improve your health and well-being. Be sure to take care of yourself till we meet again. Do not waver in your dedication to your health journey. It is important to keep in mind that even the smallest of movements might result in huge advancements. Have a good time in the following video. If you loved this video, please like and subscribe to the channel. We'll see you in the next video.